exciting episode of the Crotchety Old Men podcast. This is Gary Smith. I'm here with my comrades, Paul Clemens and George Crumley. And today is the last day, or next to the last day. Well, put it like this. It's going to be the last day that we make a recording in 2025. Are you ready, comrades?
Yes, sir. Yes, sir.
All right.
Ready as always.
Top of the day to you. So I'm just going to toss it right on off. But before I do that, just want to wish everybody very Merry Christmas. And, some of these in the societies talking about happy holidays and all that jazz. Well, if that fits you, fine too. I just pray that every one of you within listening of hearing my voice have a very blessed, safe, and peaceful holiday. Okay. With that being said, Mr. Crumley, any words?
Oh yeah, I mean, we want to kick it off right this year. Obviously, we haven't put a podcast out in a while, so we want to talk about something that that's been in the news, which is healthcare, and that's one of the things that seems to be a big hinge pinch for everybody in America, whether you're working, you're using your employer benefits, or if you're unemployed or retired, Medicare, or you're using Affordable Care Act. There's always different flavors, but it seems to be in the top of the news every day. And so I was doing a little research, and I found out that the United States, or America, has the highest health care, or most expensive health care in the world, which in itself states a lot, and you ask yourself why. And as I remember back when we started doing prioritization of different elements of healthcare, they always said that was one of the key factors. Is I always say it's going to create competition, which is going to create lower costs. But it just seems like we would have learned over the years that it don't work that way. The little factor of greed always seems to seep in. And, that one particular company, whether it's a drug manufacturer, who has a patent on a particular drug, he realizes that he can charge more because there is no competition. And that's what seems to be one of the things that seems to seep in and really make it more expensive. But yeah, I mean, it's the cost. It's which is the most thing that I see, which makes healthcare very expensive. It's the cost.
Well, no doubt, George. Cost is certainly one of the issues. I look at the cost aspect primarily as an ancillary antidote to why healthcare is where it is in America. Not only do we spend more money on healthcare, and it's kind of like the afterthought, but shucks, what causes those costs is the unhealthiness of our people. All right. And sure, certainly we could have an episode probably for the next 12 months about everything from what we eat to how we live, work, and play in today's society. Majority of stuff that we're doing nowadays primarily does not require a lot of physical activity. And it starts in the home, like most education typically should and does, is that our society has changed to the point where, before we did a lot of walking just naturally. Okay. Our mentality now, unfortunately, is that when you go to a mall or a store or whatever, instead of parking as far away from the door as you can, you're darn near in the lobby with your car. So I'm just opening it up to certain other sectors or areas and reasons why healthcare in America is so expensive compared to other nations. And more importantly, and certainly particularly, why in the African American community are we suffering from some of these chronic diseases that were almost absent from our lifestyle in the past? PC?
Well, I can speak to that. Good morning, fellas, and good morning, everybody. One of the reasons why the black people suffer more disease than their counterpart, simply because the DNA is different. And because the DNA is different, you have your healthcare is based on a white man 40 years of age. That's the model that they use for healthcare. So when you look at that, and you look at the fact that certain items, I mean, we're talking about kitchen items, affect you differently because your DNA is different. Okay, so we foods that have fats in them, we respond to them differently. That creates cholesterol for us. Kidney disease. You put us on a pill, and the pill racks your kidneys within the 10 or 15 years. Now you've got kidney disease. Most black people are walking around with 2, 3, and 4 stage kidney disease right now. And so what happens with that is that now you have dialysis shops that you've never had in communities before. All the dialysis places that I've ever saw were in the suburbs. Now they've got them. Matter of fact, in Detroit, for instance, you've got 2 dialysis places that are right across the street from each other on Livernois. So this speaks to the heightened alert that we need to have as black folks, in terms of asking our doctors how medicines affect us differently, and even how holistic herbs affect us differently than they do white people. And so that's one of the reasons that I can account for why we have such disease. A lot of things that are processed, the processed foods is another thing. We react differently to processed food. It puts more fat in us. And so we have to think in terms of what's best suited for our DNA when it comes to treatment, when it comes to overall health in general.
Guys, I hear what you're saying, but you're saying that the high cost of medical in the United States, we're the main cause of that, and I'm not sure that's the reason. I mean, we've got a system out here, regardless of how much you work out, how much you eat the right foods, and take care of your health. But we've got a system where we've consolidated all the hospitals. They've created a system where they got all these different portals, and every doctor you go to has his own portal, which makes it here again more costly. We got 3, 4, 5 different layers of administration, to get something simply done. So, I get it. We all own a certain part of our own health, but there's so many factors outside of our control that are making, it very, very costly. I mean, I got a simple, I needed to change my dental coverage. So I ended up going with one company, and they said, okay, we're going to charge you $85 a month, but you can't use 100% of the services until you've completed the first year of being with us as a company. What?
Well, you know what, George, that's just another aspect of it. I was speaking in reference to Smitty's point of view in terms of how we affect our own health and how we drudge through our own health recovery and systems. You've got another point that's so important because of this competition. You got drug companies that are making pills, they're in competition with each other. You got insurance companies. The insurance companies are telling the doctors what you can test and what you can't test based on what they'll pay for. And the other half of it is what comes out of your pocket. Now, when you look at other health systems in the world, when you look at the United Kingdom, when you look at Sweden, those countries they have a universal health care. So we're not paying out of pocket. But what they are doing there is that health care coverage is funded through their taxes and their Social Security. So, It's a matter of what we want to do here, but we certainly have the ability. We have the money here to do it.
Here's where my thoughts come in terms of that. We are what we eat, number one. We do have some control. You don't have to eat some bacon. You don't have to have a fried steak or whatever. And I'm not proposing that everybody out there become vegans or vegetarians. However, we are responsible. We have to take responsibility for our own rescue. Now, sure, we can say they, and yeah, I agree with everything that's been said so far. The drug companies and the gouging of the pharmaceuticals and so on and so forth. But if you drink enough water on a daily basis, I'm not a physician by no means, but I gotta believe that if you drink enough water, just something as simple as some doggone water, chances are that's going to keep you out of that dialysis chair. If you cut back on alcoholic beverages, there's a high probability that'll keep you out of that dialysis chair. If you just simply eliminate eating processed meats totally, period. Forget about our DNA, about white folks is lactose tolerant, they drink milk and all that kind of nonsense. I don't have a doggone thing to do with you between you living or dying from a daggone disease that you were not born with. There's too many of us dying from all these chronic diseases, and we spend hundreds and thousands and millions of dollars treating the cause of, these chronic diseases like high blood pressure, diabetes. Y'all know what I'm talking about, cancer, and all this stuff. We have to take control of our own position here on earth, much less in America. Be responsible. Okay, I'm just as guilty, or was just as guilty as damn near anybody else on this call and anybody else that could hear us. But it was a wake-up call when COVID came through and wiped out so many Black folks up here in Detroit. They had a memorial over at Belle Isle with everybody's picture. I mean, thousands. 90% of those people died because they had one of those chronic diseases I'm talking about. And sure enough, those who know Detroit, and I'm probably sure there's probably other areas in the country, there are food deserts in our communities. Everything fried. You can walk and go get some fried chicken, fried bologna, whatever the hell else is out there that they fry. You'll have a hard time, chances are, finding some fresh kale, fresh beans and lentils and things of that nature. But that does not stop us, because there's other areas where there's outside of our community, unfortunately for now. But as I'm finding, there's a lot of people who are becoming more and more conscious about taking care of your body. Lastly, the largest animals on this planet are vegetarians. So to the men out there, you got to have some meat to get your protein. You got to have some meat to be strong. BS to that mess. None of us out here. Well, there are some people now about as big as a damn cow, weigh 1,200 pounds. But cows, the feed that we feed to the cows, if you just skipped the cow and ate the feed or the grains and stuff, you'd be just as strong or big as a cow or a hippopotamus or an elephant. There's a lot of us out there that are damn near those sizes of elephants, hippopotamus, and cows because we're eating the wrong doggone stuff and we're dying from it. So no, we got to take responsibility for our own health and choose wisely about how we're going to eat.
Yeah, I get it, Smitty, and we us three are probably not typical people that have health issues. We've been very fortunate, but statistics state that the average married couple in 2026 will have to pay over $550 a month for medical insurance. Okay, so I don't care how many cows you don't eat, I don't care how much grass you graze on and how much water you drink. That's a cost that you're not going to skirt. Okay, now you can skirt it, But what's going to happen is something out of the blue is going to happen to you. And, that's where the cost is going to come in. They say, the average cost, if you break your leg, the cost of that is $7,500. So, I hear what you're saying, and I agree. We all have to take a vested interest in our health and what we eat and what we do. Processed foods are not good for you, but there's so many things that are out of our control that regardless if we're the healthiest person, in the room, there's a certain cost that we're not gonna, they're gonna happen regardless.
Well, I don't know how many people break their legs during the course of a year. Okay, but I do know how many folks catch colds. Okay, let's start with that one. That's something, and some folks talk about it's normal. It's a common cold. Bull crap. I'm 75, almost 75 years old. I haven't had a cold, and I can't even tell you when. Okay, and I'm just one of those. All right.
You get a flu shot?
I don't take flu shots. No, sir. That's what I'm saying. No, I have never had a flu shot.
Why, Gary?
Because I don't trust that mess. The first time I had a flu shot, it made me so daggone sick. I thought I was going to die.
And you know why that is?
Probably because they shoot you with that crap.
Okay? Well, no, what it is, and you're right, it's crap in a sense because your flu shot this year is based on last year's bug. Last year's bug. Well, no.
I'm listening to you.
Last year's bug had one head, 4 legs, and 2 wings. When you get your flu shot this year, thinking you protecting yourself with this year's bug has 2 heads, 8 legs, and 4 wings. So the flu mechanism is working behind. What they're trying to do is make sure the symptoms aren't so severe that it sends you into pneumonia or congestive heart failure or whatever, which is no more than just symptoms.
Well, again, I take they out of the equation, because it's that, again, that's post talk that we're talking about here. If you get sick, and I get it. Yeah, the healthcare cost is through the roof. All right, there's no doubt about that. But hell, that's why they got things. Don't people save for a rainy day? Don't they have these HSA funds? We got all kind of ways to address that. But there's 2 things I was taught younger. 2 places you want to keep your behind out of. That's prison and a hospital. All right. And so, first of all, let's take control of that. All right, barring an accident. Yeah, George, you're right. I mean, hell, go ahead.
So here again, I hear what you're saying, and like I said, I am one of us 3 that definitely takes, a serious look at my health on a daily basis. We do the exercise, we eat the right food, all that stuff. But here again, Affordable Care Act. Right now, the average person, and the reason they're on the Affordable Care Act is because of the fact that they can't afford regular insurance. Right now, they're paying about $125 a month. Starting January 1st, that will be $625. Whether they're sick, whether they're healthy, whether they're drinking water, that's something they can't control. And these are the things that I'm saying that are affecting, and like Paul said, they're avoidable. Anytime you can give $20 billion, for military, you definitely can give, a quarter of that to keep people healthy. It's all by design, if you ask me. It's by design. We are not the most expensive country in the world because of health, just by happenstance. It's by design. It's to eliminate people, And you're right, Gary. You got to take stock in your own health, because if you don't, we know what the end result is.
Yeah,
and you're right, George. That's the way to bring it home too, because I mean, both of you are saying different things, but it's like, you can have different wings on the bird, but it's still on the bird. You know what I mean? So in your case, George, you're speaking in reference to the system, and the system is corrupt. I mean, let's just face it. I mean, first of all, they're not caring for your health; they're caring for your symptoms. Okay, they're set up to just deal with the symptomatic causes. Dig what I'm saying? So that you're not cured of any particular disease, because if you were, they would stop making money.
Right.
And that's why they're killing holistic doctors left and right now, because of the threat of them losing billions and billions of dollars, and that's per organ. That's per organ. And by the way, Gary, millions of people break their legs and other appendages annually. So it's a lot of folk that get their legs broke. But but back to
how many people die from it?
I mean, people die.
I have to look that one up.
But if they can't afford insurance and they don't get it treated,
but the fact of it is, when you break your leg, whether you die or not, you still got to go through this insurance system. And this insurance system is going to tell you whether, in one case, they'll give you a CT scan, but you need an MRI to put that bone back together succinctly. And because this insurance company is not going to, they say, well, you have a CT scan, we're not going to pay for an MRI. Now the bone is set in properly, and all kinds of things happen from that. Infections occur. I'm with George on the system part. The system part is corrupt. They're not trying to kill you.
Let's okay, because we can talk about what the problem is from now on. So what solutions do you gentlemen recommend or offer?
Holistic medicine is one big solution. I mean, when you talking about the kinds of things we eat and whatever the case might be, you take a look at your blood type. You see what blood type you have. If you're A, you don't need to eat meat. If you're B, you do need to eat meat. If you're O, you can either go meat or meatless. Having regular checkups. When you go to the doctor, be your own advocate, because they're only gonna do what they're taught and what the system tells them to do. Certain types of things you have to demand. Like when we go to the doctor or the urologist, for instance, demand that you have a finger exercise, if you know what I mean, or demand that you have a PSA test or whatever. They're not doing PSA exams anymore unless you really ask them in a lot of cases. So a lot of it has to do with just being your own advocate with your health care. Second thing of it is there's a lot of herbal and holistic remedies that can be used. And I'm pretty sure the way things are going right now, that people are going to have to turn to holistic medicine because it's a lot cheaper. You can afford it coming out your own pocket. You don't need a system necessarily. They're going to tell you, well, it's not FDA approved, but all the stuff that's FDA approved is what's killing us.
George?
Well, Smitty, I don't know exactly what the answer is. Here again, I'm a prime example of exercise and eating right, and I ended up in the hospital, for no reason that I can explain. So, and I'm faced with, whatever cost is going to cost, So, what the answer is I think as a community, of people, we have to change our focus on what's really important and understand what's really killing us. I mean, when you look at Fruit Loops, you go over in England, they don't sell stuff like that.
Right.
But here again, you got these large companies that's been making money off of these sugar additive kind of foods for years. And they make one brand for us and they make another brand for folks over in England who are much more healthier than we are. I know I've traveled over there and the people look more healthier than we do. So, I mean, when you say, what's the answer? No, it's not a simple solution, but I think it needs to be a gathering of people pulling together and demanding, better health resources and better food that we can eat. I mean, you look at the 6 o'clock news, if they don't show 8, see your doctor and ask for these particular medications, I mean, it's ridiculous. I mean, they make it like it's a common thing that you need to have all these different drugs in your body and you got to be, running and asking for these drugs. Look, asking my doctor, should I take so-and-so drug? That's crazy. instead of saying, like you say, eat corn or, eat things that's going to be healthy for you. So is there a quick fix? Is there a quick answer? I have no idea, but I know that if we don't, as a community, band together and put some pressure on these people that are making these decisions, this stuff ain't gonna get no better.
And that's a good point, George, because we vote representatives in, and representatives they represent not only us, but they also represent where they get their money from to run for office in the first place. So when you have these folk that get large sums of money from these people who these insurance companies and all these folks like that, it's that's what this system is based on, and we have to vote that system out by being able to use our political leverage.
We were not looking for a quick answer necessarily, because people don't go from a normal weight according to their BMX or whatever the heck it is, BMI statistics, to the size of a hippo overnight. But one thing I know for sure is that you can see it. You can see it in our children. Used to be a time in school, you go to school, any school, you didn't find anybody. Everybody could climb a rope to the top. You go to gym, you have these PTs, exercise or whatever. There were the chairs were what the chairs were. Now you got kids talking about these chairs too small. No, your ass is too big. Okay, that's the problem. All right. And I hear it all the time. Well, the airplane seats are smaller. No, let's go again. You want to play they need to change the seats. They need to do this. No, it's something that you got to do, because every time you point a finger this way, 3 of them is pointing back at you. Take responsibility for your own freaking rescue. Again, you want to stay out of jail? Don't commit a crime. Don't get a felony. You want to stay out of the hospital? Do your best not to slip and fall. Okay, break your legs or break your arms. That kind of crap is going to happen. That's called life. But what does not have to happen is that you do not have to die from cancer. You do not have to die from a stroke or a heart attack. And you do not have to die from chronic kidney disease. Those things are within our control. So as I close, control those things that you have control over. There's not a senator, president, or governor on this planet that's ever gone shopping with me. Okay. And I choose to get some greens and beans or some licorice and a Pepsi. So, no, we don't have the solution today, but I think collectively all of us can come up with some solutions so that we can live healthier, happier lives. Because you're either going to pay at the pump, as they say, when you get into one of those daggone situations in the hospital, and yeah, it's going to cost you a hell of a lot more money, or you can take that $500 or $600 or $700, $800 insurance premium that you got to pay to stay. You can't stay healthy, but to get treated, and you can start changing your diet. Now, I'm not saying you stop your steak and your pork, overnight, but hey, if it's going to help you live a little longer, help you not have as many aches and pains, as many hip replacements and knee replacements. You know why you got to replace your doggone knees? Not everybody played football and basketball. Your knees wasn't made to carry the weight of a hippo. Okay. So do something about that. Why you think Ozempic is selling so much? People realize this. Okay, but they want, instead of having their cake and eat it too, they want to have their steak and eat it too. Now, I don't know what the end results are of shooting yourself in the daggone stomach and going from 380 pounds to 100. I don't know. Only time will tell what the end results of that is. I would recommend that you take a much safer route, choose more, plant-based meals, et cetera, et cetera, et cetera. And who knows whether I'm right or wrong. Chances are you'll feel a hell of a lot better than taking all those pills and all that stuff and still not have a quality life. All right, crickets. That's what you hear when you start talking about healthy eating and healthy lifestyles.
Oh no, I mean,
Oh no,
I'm
no,
on
I'm
that.
not in that circle at all.
I'm on that track. I eat very healthy. So yeah, I mean, I cut out steak long time ago, and pork long time ago. So and I drink, you know, 6, 7, 8 glasses of water. I've had 3 this morning already. So it's a way of life. I've already exercised an hour this morning. So yeah, I mean, it's a way of life. But I think that
And the reason that you have to pay and we have to pay so much for health insurance because of the other millions that don't do that, George. You're not
well,
That's part of
yes,
part of
yes and no.
10x that.
Like I said, there's a system that's out here that
that's part of it. That's part
But
of it.
George, now listen, even though that system exists, it has not stopped George Crumley from taking control of his life. Okay. The
But
reason
you
you
said it, like you said, I gotta pay regardless.
you got to pay regardless. Why? Because there's a whole bunch of other ones out there that ain't doing what George Crumley's doing.
No,
Okay?
that's
So
that's
we
not
have to
necessarily
end up-
true.
It's
No.
huh?
No, it's not necessarily true. I mean,
Not
because
Gary.
somebody, there's a group of
Compared
people
to
that decide
other
they're gonna make.
nations that don't do that. Come on, y'all. I mean, hell, insurance is it based upon actuarial statistics? Now, I'm in the insurance business. Now, I know something about actuarial costs. Come on. That's how it rates. They rated by the number of folks that's got their butts in hospitals. Now, of course, they upcharge on that. And yeah, people going to exploit that because this is a capitalistic society here called the USA. Absolutely. No different than, heck, using slave labor in the prisons. Hell, slave labor out here in the general population. You talk about healthcare, go to the nearest skilled nursing facility. Those people are so underpaid. I mean, they're making $5, $6, $7 an hour to go down to room 101 and turn over somebody's grandfather or grandmother who are unable to wash and bathe and feed themselves. That's wrong. That's a corrupt system. But yet the skilled nursing facility owners, they out there on their yachts. So now we are burdened because you don't want your parent or loved one or somewhere sitting in one of those daggone pig sties. So now you got this home health care business going on. Well, again, there's tons of millions of dollars in that business, and that industry is growing exponentially because there's not enough people to service the sick, and the underserved people population that's getting older and cannot provide for themselves. So it's not just paying at the pump as the hospital, but you're paying those costs either way you go. So the best thing you can possibly do as a solution, until one is certainly brought to the fruition where everybody can afford it, is to try to make sure that you and your loved ones at least get the knowledge and help their own selves to stay healthy, man. That's it. Just look at the businesses. Look at the
I mean,
industry.
you get no disagreement from me on that. You have, like you said, you have to take ownership in your own health, and if you don't, you're making a big mistake and looking toward things down the road that they could come up unexpectedly. Yeah. But like I said, when you look at the system also, you can't have it both ways. You can't have great health and then high expenses. You can't have it both ways. So I mean, that's something we're fighting as far as an uphill battle, with one of the things here in America. Like I said, we're not going to solve it today, but here again, be aware of it, and do something about it other than, stop eating cornflakes. You got to get out there and make sure, like Paul was saying, got to make sure you got the right people that's representing you to change some of the stuff. Some of the stuff needs to be changed. I mean, every dollar doesn't have to be spent on war and weapons and things like that. At some point, it needs to be spent on healthcare.
And that's a big thing, George. They spend $990 billion on a war machine. The closest adversary spends $365 billion. And you mean to tell me you can't subdue an adversary spending $700 billion and the rest of it going to healthcare or education or whatever you deem it necessary? Yeah, this system, in my opinion, is corrupt. And it's corrupt because money has driven folks are genuflecting to the god of profit. When you look at other countries like like I was mentioning before, the United Kingdom, Sweden. There's a number of countries, Libya, folks. These countries are paying for people to be healthy and not go to the hospital, and they're also giving you free health care. So when you do have to go to a doctor or a hospital, it's paid for to keep your butt out of the hospital. So I think it's a twofold situation, actually threefold. I think in a lot of cases, Smitty's got a hell of a point when he talks about, making sure you do what you have to do to be healthy. George, on the other hand, you have a hell of a point because the system is corrupt. They're just putting out drugs out here to put band-aids on situations. And when you take that drug, you're going to need the drug to another drug to counteract all the shit that the first drug gave you has to do. So what kind of mess is that? I mean, you know what I mean? And the third thing is looking at alternatives. The holistic approach is one alternative. Ayurvedic medicine and Chinese medicine are other approaches that you can take. You have herbs. You need to read. You can't get around not reading and educating yourself on stuff. So I mean, there are some solutions out here for us if we grow your own vegetables. What you done put in that dirt. There's no pesticides or whatever in that dirt to make you sick, give you all kinds of inflammation and whatnot. So there's some solutions out here that we could suggest to the public, and it's all good. It's all good. It's all good. We're all saying the same thing in different measures.
All right. Well,
yeah, I'm gonna be concerned. Another good episode, guys. Good information, good discussion. Hopefully our audience can grab a few nuggets from this and understand that, there are more things involved in why healthcare is the way it is. And hopefully it'll take some stock and help and improve the situation. As always, guys, what kind of words of wisdom we going to shoot out today? Who's got the
Gary, I know you got
tablet.
See it on your head right now.
You got the stone tablet.
I don't have a tablet near, but here's the words of wisdom right now. In that, no matter, you can't underestimate a man or a woman who overestimates themselves.
Damn.
Okay. Do I need to repeat that?
Yeah, for the people in the back.
Don't underestimate a person who overestimates themselves.
Hello.
Well, guys, as we always say in the Crotchety Old Men, if you didn't know,
now you know.
Take care.
Happy New Year.
All right. Peace, y'all.